Hi, I'm Dr. Luther Kalb, Assistant Professor at Kennedy Krieger Institute in the Johns Hopkins Bloomberg School of Public Health. It is estimated that about 1 in 10 youth in the United States suffer from a psychiatric disorder. And many of those children, unfortunately, never receive treatment. So the emergency department has become a safety net for youth without a mental health provider or who are in crisis. So understanding changes in those visits is important to preparing for care in the emergency department, but for understanding changes in population health. The first objective was to examine changes in psychiatric emergency department visits across the United States among youth 6 to 24 years of age. The second objective was to examine changes in those trends across different age groups, gender or sex, and race and ethnicity. And the third objective was to examine what's associated or correlates of those visits. Particular attention was paid to self-injury or suicide-related visits, especially within adolescents. So between 2011 and 2015, emergency department visits for psychiatric concerns increased across the nation. The biggest increase was in 2015. Young adults aged 17 to 24 years of age had the most amount of psychiatric emergency department visits in the United States. And there was a slight increase in trends over time. However, the largest increase in visits over time was among adolescents and non-white youth. Unfortunately, only about 1 in 6 youth who visited the emergency department for psychiatric concerns saw a mental health provider. So consistent with the CDC estimates that have shown that suicide is increasing across the nation, visits to the emergency department for suicide or self-injurious related behaviors is increasing as well. However, it only increased among adolescents, but it was a large increase. There was about 2.5-fold increase in those visits between 2011 and 2015 among adolescents. Only about 1/3 of these youth who visited the emergency department for suicide or self-injurious related concerns received treatment. So rising emergency department visits for mental health concerns is not a new phenomenon. It's actually been going on for some time. We don't really know why, but there could be a lot of different reasons. It could be greater recognition by emergency department staff. It could be increased screening efforts. It could be greater reporting by the child or their parent, but it also could signal important changes in population-based mental health. Either way, adolescents clearly are a population at risk for suicide-related visits, and young adults clearly are at risk for substance abuse-related visits. This suggests that greater intervention is needed among these groups. It also suggests that we need greater expertise to address these specific problems among these specific groups in the emergency department. There are promising efforts going on nationally to improve the quality and quantity of mental health care in the emergency department. These findings clearly support those efforts.